Hello friends, welcome to Dr. Osman's Trends, swing into educational trends. Friends, even as the coronavirus outbreak takes the world by storm, a number of other diseases are also coming into existence. Cases of swine flu and bird flu have already been reported in India and other countries. Now a man from China has tested positive for Hantavirus. According to China's Global Times tweet, a man from Yunnan province died while on his way back to Shandong province for work. The 32 other people on the bus were also tested for the virus. Friends, let us know what is Hantavirus, how it is spread, how it is transmitted into humans, what complication it can cause, and how it is treated. The hantavirus first emerged in 1950s in American-Korean War in Korea in Hantan River. Hantavirus first occurred in area of Southwestern United States, which includes Arizona, New Mexico, Colorado, and Utah. After much research and testing, experts linked the pulmonary syndrome with the previously unknown type of hantavirus. In 2012, outbreak occurred and 3 people died out of 11 infected cases of hantavirus. In 2017 also, 17 people developed infections in 11 states of South America. Let us talk about the spread. It spread when deer mice, cotton rats or rice rats shed the hantavirus in their urine, feces and saliva. They become airborne. Transmission of virus to humans occurs when people inhale air contaminated with the virus. It may also enter the human body if the infected rodent rat bites a person, touching something contaminated with infected rodent urine, droppings or saliva, then touching the nose or mouth and eating the food contaminated by infected rodent urine, droppings or saliva. From the time the virus is first inhaled into the lungs, the incubation period for the hantavirus is usually 2 to 3 weeks before symptom appears. Hantavirus is mostly not contagious in United States but has transmitted in few countries. Now let us talk about the reasons. The exposure to rodents that carry the virus. If you live or work in an area where carrier rodents are known to live, infection is possible. Any activity that can put someone in contact with rodents, droppings, urine, saliva or nesting materials can put a person at risk for hantavirus infection. House cleaning, sweeping or vacuuming or other actions that stir up dust can release infected particles into the air. Work exposure. People in certain occupations such as pest controls, constructions or utility workers may encounter rodents. Camping, hiking, using shelters or camps that are rodent infested. Cleaning unused buildings, structures that have been closed such as sheds, cabins, barns, garages and other storage facilities may house rodents and old droppings. Now let us see how this disease occurs. Hantavirus causes pulmonary syndrome or respiratory disorder. Now let us talk about the signs and symptoms. Signs and symptoms of hantavirus can easily be mistaken for the flu. So it is important to tell your doctor if you leave work or have recently traveled to places where there are large rodent populations. Early symptoms of hantavirus pulmonary syndrome resembles the flu and the illness can be difficult to diagnose. The early stage of hantavirus pulmonary syndrome lasts 2 to 8 days and signs and symptoms may include fatigue, fever, muscle aches, headaches, dizziness, chills, gastrointestinal disturbances like nausea, vomiting, diarrhea and abdominal pain. Cough, shortness of breath and sometimes heart and lung failure may occur. Now let us talk about the diagnostic test. Low platelet count, increases in blood levels of lactate dehydrogenase and elevation in hepatocellular enzymes and serum lactate. Friends, let us talk about the treatment. There is no specific treatment for hantavirus. It is important that the infection is diagnosed as early as possible so that patient can receive supportive care including oxygen therapy, fluid replacement and blood pressure medication. Kidney dialysis also may be needed sometimes. Patients are usually admitted to intensive care unit for treatment. An antiviral drug called ribavirin is used to treat different strains of hantavirus including hemorrhagic fever with renal syndrome due to Hantan virus. This drug has not been shown to work against the strains. However, in some cases, doctors may try it. The mortality rate for hantavirus pulmonary syndrome is relatively high. It is fatal in 38% of, so early recognition of infections is very important. The earlier the intervention, the better the prognosis. And those who survive usually recovers quickly. Friends, let us talk about the prevention. The Center for Disease Control and Prevention suggested limiting contacts with potentially infectious rodents in affected areas to help prevent hantavirus pulmonary syndrome. Minimizing or eliminating contacts with rodents in the home, workplace or other areas. Cover and seal all holes that might allow rodents to enter the building. Open and air out seldom used buildings before entering. Eliminate potential rodent nesting sites by clearing brush and debris. If rodent nesting sites are found, soak nest with 10% bleach prior to removal, and wear latex gloves during cleanup. So friends, do like, comment, share and subscribe, and do not forget to press bell icon. Thank you.